The Green Air Primary Care Wales Framework and Award Scheme, led by Public Health Wales, was launched nationally in June 2022. A first of its kind in Wales, the scheme supports the 4 independent primary care contractors: general practice, community pharmacy, primary care dental, and primary care optometry to build climate-friendly actions into their day-to-day practices. There are currently 710 community pharmacies in Wales, which form a pivotal part of the healthcare system. This video has been specifically developed to look at the great examples of the framework actions that have been implemented within community pharmacy, with a specific focus on the JDS Evans Pharmacy, an independent community pharmacy in Newport, South Wales. This pharmacy, a Gold Award winner in 2022, has sought to improve the carbon profile across all the different framework actions, offering sustainable dispensing choices and services. Andy Evans, who runs JDS Evans Pharmacy, is committed to a green future for the pharmacy and was an early mover installing a 7.5 kilowatt solar panel system in 2015 to reduce electricity bills, which are now approximately £2,000 in total annually. An electric vehicle charging point has recently been installed to enable vehicles that deliver medicines to the pharmacy to charge. An electric air conditioning system provides heating and cooling for the building, which is regulated using programmable thermostats. The pharmacy has also gone through a program on converting store lighting with LED alternatives. The pharmacy has double glazed windows with good seals. The loft of the pharmacy is lined with high-performance insulation made from 100% post-consumer recycled content, with the recycled material coming from ocean-bound plastic. The outside of the pharmacy is well maintained with a series of potted plants creating a green space, optimising the biodiversity of the area. An area to lock up bikes has also been created to encourage staff and patients to cycle to the pharmacy. On average, the pharmacy dispenses 3,500 prescriptions per week. The pharmacy prioritised the purchase of medicines manufactured by companies committed to the environment. For example, those that have unit dose presentation with QR code, that use recyclable packaging, generate less waste, or have a record of the carbon footprint of the medicines they manufacture. Prescriptions are only dispensed in bags which are 100% recyclable and compostable, made from 100% recycled content, manufactured with water-based inks. The pharmacy participates in the Novo Nordisk Pen Cycle Recycling Initiative for pre-filled injection pens. This initiative is designed to address the challenge of recycling injection pen devices used by people living with diabetes and other medical conditions, which would otherwise end up in landfill or incinerated. Users are able to recycle their empty pens by returning them to the pharmacy. Extending the open hours of a pharmacy is not always financially viable and also creates an additional carbon footprint. JDS Evans Pharmacy recently installed a 24/7 automated prescription collection system. The collection system provides a simple and secure way to make the dispensing process more efficient whilst giving patients the best possible experience. This enables patients to pick up their medicines whenever it's most convenient for them. For the pharmacy, this has meant no more queues or wasted journeys by patients to check if their medicines are ready. Patients typically collect prescriptions when the pharmacy is closed, which has significantly reduced congestion on the road which the pharmacy is located. Pharmacy staff have taken an active role in optimising respiratory care to reduce the carbon footprint related to inhalers. With patient consultation and consent, this has involved switching metered-dose inhalers, MDIs, to dry powder inhalers, DPIs. MDIs contain hydrofluorocarbon propellants, which are more than 1,000 times more potent than CO2 as a greenhouse gas. So switching just one patient to a dry powder inhaler can save up to half a tonne of carbon annually. This is a great example of how pharmacists and patients can work together on climate change. The whole team at JDS Evans Pharmacy are passionate about sustainability. Success has been down to Andy championing change and enthusing others to get involved. Some of the other actions implemented at the pharmacy include the installation of an energy-efficient pharmacy fridge with energy-saving controls, the recycling of different waste streams with specific recycle bins available for cardboard, plastics and food waste. The pharmacy also recycles hard-to-recycle materials and is a collection point for unused or unwanted medicines. The whole team are fully brought into these simple but far-reaching activities. JDS Evans Pharmacy is the first net carbon zero community pharmacy in Wales. In addition to improving the carbon profile across the different framework actions, the The pharmacy has also committed to planting trees to offset the carbon emissions that cannot be reduced by practice changes. In 2022, this was circa 4 tonnes of carbon, the equivalent of planting 4 trees. The pharmacy has the ambition to do more. For example, Andy Evans is looking to concentrate his orders to one supplier rather than the current profile of using a main wholesaler and 6 smaller suppliers. Whilst this is likely to be more expensive, the resulting benefit is a reduction in Scope 3 emissions. Andy is also looking at options to install batteries to the existing solar panel system to store the electricity generated when the pharmacy is closed, to then be used at a later date.